is Mental Health Awareness Month, and throughout Idaho, we've seen growing incidents of mental and behavioral health issues, but there is help for those who may need assistance in managing their stress, anxiety, or depression. Now, joining me to talk about some of the newer care resources is Dr. Heidi Greenberger. Dr. Greenberger has a background in epidemiology and is Vice President of Clinical Research at Able2, a leading behavioral health provider offering virtually delivered mental health care to people in Idaho and across the nation. Dr. Greenberger, thanks for being here this morning.
Pleasure to be here. Thanks for having me.
Of course. So can you just take a moment to talk about the important components of virtual mental health care?
Absolutely. So, virtual mental health care, also known as telemental health care, is therapy or counseling delivered by telephone or video instead of face to face in a provider's office. This type of care delivery has become increasingly more popular since the COVID-19 pandemic. In fact, it's estimated that as many as 1 in 3 or more mental health care visits are taking place by video or telephone today.
Okay, and that makes sense, especially because of the pandemic. But what would you say the range is of challenges or concerns that lend themselves to the care that you were just describing?
That's a great question. So, the research tells us that the most common mental health conditions that US adults face are effectively treated by telemental health care, and they include depression, anxiety, post traumatic stress disorder, and other conditions. This is really important because, as many of you know, more than 20% of US adults are affected by one or more mental health condition. And at the same time, we know that 1 in 4 individuals with symptoms of depression or anxiety may report that they're unable to get the therapy or counseling that they need in the month that they need it. And so telebehavioral therapy or telemental health care overcomes many barriers to care, such as eliminating the need to travel or leave your home if you're not feeling well, or also bridges gaps in geographic barriers. For example, we know that there can be provider shortages in some areas, and telecare delivery allows you to reach quality providers from the comfort of your own home.
Perfect. Now let's talk about some of the results that someone seeking that type of care can expect to see.
Absolutely. So, individuals seeking care via telemedicine can expect the same results that they would receiving the same type of care face to face in a clinician's office. For example, when you have your first initial consultation, you can expect that your therapist will take the time to get to know you, understand what brought you into care, and work with you to develop a care plan and set goals. You can expect that over time with therapy that your symptoms will improve, the same results that you would have for face-to-face delivery.
Perfect. Great stuff. And we're just about out of time. So for anybody that's looking for more resources, where can they go?
So, first of all, if you're in crisis, dial 988 to reach the National Suicide and Crisis Lifeline for immediate support. But if you are not in crisis and seeking a care provider, your primary care physician, as well as your health plan, should have a curated list of providers giving quality care both virtually and in person.
Awesome. All right. Great stuff there. Joining me this morning has been Vice President of Clinical Research at Able2, Dr. Heidi Greenberger. Doctor, thanks so much for being here and the great advice.
Thank you for having me.